presentation, Dr. Maria Gamvruli. Thank you. Primary care systems responses during COVID-19 pandemic worldwide, a systematic review.
Good afternoon. Let's start. Primary care focuses on medical care and is the provision of integrated, accessible healthcare services by clinicians who are responsible for addressing the majority of patients' healthcare needs, developing a sustained partnership with patients and practicing within the context of the family and community. In keeping with the commitments of the Declaration of Astana and of the Political Declaration of Universal Health Coverage, primary care services as a foundational and central element of robust health systems faced the risk of being overwhelmed by the current COVID-19 pandemic. A primary care setting is often a patient's closest and first point of contact with the healthcare system. In the early months of 2020, tremendous pressure was placed on healthcare systems due to the pandemic. Countries worldwide responded to these demands and prepared for future waves by rapidly building up dedicated tertiary care facilities and other treatment centers. The health systems of some countries were not able to expand hospital capacity and the health workforce capacity as quickly as they would like. Primary care became increasingly important and in both high and low income and middle income countries as a secondary and tertiary hospitals were overwhelmed with patients who needed intensive care. During the 2009 H1N1 pandemic, primary care was important in managing patients and implementing pandemic policies. The primary care safety net is critical to treating adverse population and providing surge capacity in such situations. Due to the middle to the moderate onset of COVID-19 symptoms, primary care is crucial for the prevention, triage, diagnosis, and management of patients in the community. A robust, comprehensive set of guidelines was needed to support the primary care response to pandemics. Public health functions provided by primary care included health protection and promotion, disease prevention, community-based screening, testing surveillance, and emergency preparedness. Given that the main benefit of guidelines is to improve the quality of care received by patients, there is a need for rapid research and synthesis to inform and the creation of guidelines that support primary care providers in the delivery of quality care during the pandemic. The aim of this systematic review was to investigate the available national primary care guidelines for COVID-19. Let's see the material and methods that we use. Search was performed on PubMed and Scopus for studies published until December 31, 2021, with the keywords guideline, Ministry of Health, COVID-19, Centers for Disease Control, and country name, which were searched in the title and in the abstract of the studies. We also searched references of the selected relevant policy documents for additional related information. We consider guidelines to be documents issued by national authorities within countries that communicate the intention of the national authority as to how COVID-19 should be diagnosed, treated, and managed in a primary care setting. Studies were excluded if they were not published in the English, Greek, French, and German languages, were conducted on animals, and were case studies, editorials, and letters to the editors. Data extraction based on a framework outlining primary care challenges and responses to the COVID-19 pandemic. The framework outlines 4 key domains: clinical service delivery, public health functions of primary health care facilities, operational level functions at the primary care facility, and the health systems level factors, all of which may act as barriers to or facilitators of care provision. A similar framework was used during the 2009